Burlington Board of Health to order. Please stand and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'm Ed Weiner, and I'm Chairman of the Board of Health, and with me are board members Mary Beth Welch, Andrea Sheehan, Dr. Wayne Salzman, and remote this evening, Dr. David McSweeney, our Vice Chair, is out of state, and he is remote with us, as allowed by law now. Also with us tonight is our Director of Public Health, Susan Luminello, our new Associate Director of Public Health, Michael Green, Christine Mathis, Environmental Engineer. We have, do we have our recording, do we have our recording secretary on this evening?
So she was unable to make it, but she's going to transcribe the notes after the meeting.
And I forgot, Marlene Johnson, who hasn't been here in quite a while, our health agent. Thank you for coming, Marlene, this evening.
Sure.
Again, please note that we are live on VCAT and available for appropriate comments and questions through this great video technology. We have minutes from November 9th and November 23rd, as well as a subcommittee meeting for December 1st. Let's take a look at November the 9th. Is that me with the feedback, or?
You're not signed into the WebEx, right?
No. I guess not. So if we could take a look at your minutes from November the 9th. Are there any corrections, omissions?
Mr. Chair, I make a motion to approve the minutes from November 9th.
I have a motion to approve the minutes from November 9th. All in favor? Aye.
Aye.
5-0. I have minutes now from November 23rd. Do I have any omissions, corrections? Not, I'll entertain a motion to approve the minutes from November the 23rd.
So moved.
I have a motion to approve the minutes from November 23rd for Mary Beth. Is there a second?
Second.
Second, Andrea. All in favor?
Aye.
Aye. 5-0. And now we have a subcommittee meeting, and we can wait for that subcommittee meeting from December the 1st before we take up the proponent. Would that be all right?
Yep.
Everyone? Okay. Citizens' time. Is there anyone here who would like to talk to the board who is not on the agenda or part of an agenda item? Everybody?
Well, how does that work? So say when you're going to talk about the mask mandate, could somebody talk to you then?
Sure.
Oh, okay, all right, so I can wait, if that's okay?
That's fine, that's
Okay,
fine.
thank you.
Okay. Nobody, is there anybody online for citizens' time?
No.
Okay, which brings us the chairman's report, and I have a sort of a lengthy one this evening. As I do each meeting, I want to acknowledge our professional staff, all of our professional staff, and we've got quite a few here this evening. Our board members and all of the departments, and we have a number of people from the DPW tonight who keep this community so safe. Thank you for your hard work, commitment to Burlington. Thank you to BCAT for televising this meeting and for all you do to keep this community so well informed. The COVID pandemic is not only still with us, but new variants have evolved and now causing us some havoc. In the past months, I've urged every adult to consider getting the COVID vaccine. Now I urge you to get a booster. Parents should also consider vaccinating their children. Now, including teens as of the last week or so. You and your family are precious. Please, why take a chance? Get vaccinated. And don't forget, the flu season is now with us, so don't forget your flu shot. In the midst of all this, in the midst of the pandemic in Massachusetts, the Massachusetts Department of Public Health has chosen to deprioritize a once very high priority, very time-consuming, something that we have been very involved in, and that is contact tracing, the contact tracing program. All of a sudden, the Massachusetts Department of Public Health, the governor, doesn't think it's a high priority more. But, so that gives us some extra time in this community, although we are doing some contact tracing. We hopefully now can also get some COVID vaccine. We're working, our supervisory nurse is working to see if we can get some vaccine for the community, maybe for our town employees, staff, and citizens. So we're working to see if we can get some vaccine at this point. And last, if you have any questions for the Board of Health, please take a look at our website. It's a very good website. If you have any questions, feel free to give us a call. Our phone number is 781-270-1955. I get lots and lots of calls, like today I got a lot of calls. Feel free to call me, any of the board members, but call the Board of Health office. We'd be happy to talk to you. Before I pass this meeting along to our subcommittee reports and what's on the agenda, I want to introduce a new member of the Board of Health. I want to introduce Michael Green, our new Associate Director of Public Health. A once New Englander and Navy veteran, we found him as a public health professional in Minnesota and brought him home to Burlington. I told you we were going to do a national search. Well, we did, and we found Michael Green. I'm going to call on him to tell the community a little about himself. Mr. Green.
Thanks, Dr. Ed. I certainly appreciate it. Hello, board, hello, staff, residents. Yeah, I think Dr. Ed laid it out. I was hiding out in Minnesota, looking for a chance to get back to the East Coast, and a wonderful opportunity to work with a fun, friendly, and fantastically competent staff came up, and I jumped at the opportunity, and they've given me that. So hopefully it's only good from here on out, and yeah, can't wait for the next meeting too.
Thank you, Michael. We're so happy you came. It took us a long time to find something real good. We have one other bit I just want to say a little bit about, and that is we did have a joint meeting of the Board of Health and the Conservation Commission last week, and I'm going to call Dr. Salzman. Were you there? No, you weren't there. I'm just going to say that I was there, Susan was there, our environmental engineer, Christine Pollock was there, and David McSweeney was there. David, are you online? Did we lose David?
He is on.
David?
I'm here, Ed.
Do you want to say anything about the joint meeting of the Board of Health and the Conservation Commission?
Yeah, I'll give just a 5-second overview. I thought, only because I'm remote, this is a little bit difficult, but I thought the meeting went really well. It was a very productive, collaborative session between conservation and the Board of Health. And we, I think the focus had been primarily on, some of the changes that they want to make to their drainage. I forget the name of it. Sediment and runoff. Thank you. Bylaw, and to make them a little bit more stringent. And I think that's what they'll focus on. As of late, as you know, we've had a couple of instances throughout the town where there's been either some great changes and or some minor development causing some runoff issues that there are no real bylaws in town that catch any of those things from occurring. So they wanted to make their bylaw a little bit more stringent to catch a little bit more of those issues so they don't go under the radar. Certainly, again, they were looking for the Board of Health to work with them and collaboratively. I think I brought up one of the main thing was that about 2 or 3 years ago, we worked together to kind of bridge some of the gaps that where there was conflict between their bylaws and ours, or their regulations. And we worked hard to bridge some of those, and I didn't want to lose focus on that as well. So if they were changing or making some additional changes to their bylaws, that it doesn't pose any conflict to ours. And they were they assured us that that was not going to happen. In fact, they were going to review any changes prior to submitting them to town meeting for approval. So it was a collaborative session. I wasn't as concerned leaving that meeting as I was going in. And again, the Concom did a great job in staying focused and also including us in those decisions and conversations.
Thank you, David. On those who proposed change erosion and sedimentation bylaw, to just reiterate, my vice chair, great start, clearly illustrated how two distinct boards can work closely together to correct ongoing water and flooding problems that will better protect homeowners and businesses in this town. And I want to thank Concom Chairman Larry Cohen, who's worked so hard in this project. He has been chairman for many, many years, and as a member of this Board of Health in this community, I want to thank Larry for all he has done for this community. So, which brings us now to site plan approval and special permit 70 Winter Street, Mill Pond Water Treatment Plant. And the application is the town of Burlington.
Thank you. Good evening, Mr. Chairman and board members. I'm here with Tom Hayes, our town engineer, and we're also joined remotely by Copers Constantino. I'm losing it today. Thank you. So I was here earlier this year, and we went over the PFAS Burlington. All of a sudden, came to find out about in about May of this year. We had a very good meeting in this board, and at the time, we promised that we were going to go as fast as we could in a fast track to get a project constructed and to solve the issue of PFAS in Burlington. Town meeting has supported us along the way. Last September, we actually got funding for the construction of a PFAS filtering building for the Mill Pond treatment plant. And we are now pretty much ready to actually go into construction of that facility. We divided the contract into several contracts to expedite delivery of filters, pumps, VFDs, et cetera, which is very unique, but we needed to get this project done as quickly as possible with the goal of having it in place by the end of 2022, as we said earlier this year again. So what we're here tonight is for seeking your approval so we can actually get this project ongoing and put it out to bid in early January. So with that, I'm going to have Amy present the project, and we're Tom Hayes and I am here for any additional questions you may have.
Thank you, John, and thank you, board. My name is Amy Coppers-Costantino, and I'm with Wright Pierce, and we were hired as the engineer to design the PFAS upgrades to the Mill Pond Water Treatment Plant in order to resolve the issues you have in your source water. So as part of this project, John had mentioned we fast-tracked the design of this project, as well as the testing for this project. So right now at the Mill Pond Water Treatment Plant, we do have a pilot system installed, and we're testing right now multiple medias to prove to the town and to the board and everybody that the technology we're proceeding with will remove the PFAS to the levels needed. And in parallel with that, we've proceeded with design of the facility to install the treatment systems that are needed to maintain the capacity of your Mill Pond water treatment plant and to treat the PFAS. So as part of that, we have designed two facilities, one to pump the water from the existing Mill Pond water treatment plant. We plan to treat the filtered effluent from your water treatment facility and further treat it for PFAS removal. The technology that we've proceeded with the design of is GAC, Granular Activated Carbon Pressure Vessels, where water will go through a lead vessel, we call it, followed by a lag vessel. And what that allows the town to do is you have kind of two two barriers for PFAS before it gets into the effluent from that facility. So as water goes through the first vessel, PFAS is removed. But as during operation, the PFAS does have the ability to break through the first vessel, and you have a second barrier to capture that. And that allows the town to coordinate and schedule media removal in that lead vessel. So we proceeded with design. All the upgrades are on the existing Mill Pond water treatment plant site. It is a tight site. It's a challenging site. We do have a lot of utilities, and it's located right next to the Mill Pond Reservoir. But we've proceeded with all the field work needed to be able to put this project out on the street as early as January when we get all the town approval. And I think John had also touched on the goal is to have the treatment system online by the end of 2022. There will be some construction that continues into 2023, but the treatment system will be online, tested, and operational to deliver your residents, PFAS-free water at that point. But there might be continued construction, site construction, building construction that goes into 2023, but your treatment system will be online. So with that, I can share some site plans. I can share some overviews of the facility if you would like to see that.
Just before you begin, I don't know if everybody in the audience here knows what PFAS is. You might have read it's a contaminant in more than 90% of all the water in the United States. It's short for polyfluoroalkyl substances. I get that right, Director?
Yes.
Yes, okay. And it's a class of more than 5,000 or more substances, which comes from everything from non-stick pans, Teflon, to waterproof jackets, carpets, all kinds of materials have this PFAS. The issue with PFAS is it doesn't break down, and it ends up in our drinking water. And in higher levels can cause certain problems to our bodies. Low levels possibly to pregnant people and to people who are immunocompromised. And we have it in our water. We have it in our surface water, which is usually it's found in our groundwater, our deep water. It's found in our surface water because we get much of our water from pumping the Shawshene River. We are very lucky in this community that we have a DPW and the director, Mr. Sanchez, who's able to mix the water and keep those numbers down. So you're not drinking it heavily in Burlington. I don't know if it's any breakthrough once in a while, but it is what it is. So this town has appropriated $1 million to put in an additional facility by our water treatment plant to clear this material out of our drinking water. And we're going to need to do that, whether we connect to NWRA or not in the future, we're still going to need our Mill Pond Reservoir. So we're going ahead and doing that. This is the first step, is to design the facility. I think you picked a real good company to do that, to design the facility. We were on the call this week in a subcommittee meeting, and this is the first step in approving that facility. Mr. Sanchez, did I get it right?
I have to make a couple of comments, and I apologize, Mr. Chairman, but number one is the town has allocated $15 million.
15 million.
15 million.
And I thought you were going to do it for $1 million.
And the second one is, although we're currently taking some water from the MWRA to dilute our water, the levels throughout the system will vary from 0 to whatever comes out of the plant. So it's not an exact number throughout the town. Unfortunately, we can't have the level of actually diluting it precisely for every home. So throughout the system is at different levels.
Try to get us a discount.
I wanted to
I
clarify.
think that's all right. All right, thank you. But But I just want everyone to understand that this is something that is a major issue we gotta deal with, and the town is dealing with it. And
I just have a question about the PFAS. Is it now illegal for it to be in all those products, so then it doesn't re-leach into our water and so on and so forth?
no, not that I know of. It's still in everything.
There are,
So we have 3M to thank for that?
No, there are 5,000 different, it's even in firefighting foam, and it's at commercial airports, it's everywhere. Look it up, it's 5,000 separate products. It's amazing what it's in, even a lot of our clothes. So it's everywhere. Probably, the issue is to contain it so we don't find it in our water again. But it's really almost impossible, for what I understand, Director, that we can.
yeah, so it's PFAS is labeled as a contaminant of concern, and there are many different PFAS chemicals, and when you're testing for them, that's only testing for 6 of the PFAS chemicals that exist. So it's something that needs to be continued research on the federal and state level.
How does the NWRA not have PFAS in their water?
If I may.
Please.
So it just so happened that the source for the MWRA is the Quabbin Reservoir, which is a very pristine area of the state. So, the levels there are pretty much non-detect for that reason. Our water source, unfortunately, is from a very industrialized area where we live, where there's been industry for many, many years, including a lot of septic systems from all the houses, and those are sources of PFAS as well. So it's 2 different sources of water, and that's why they don't have any in their system.
I just kind of interesting, mascara, eyeliner, sunscreen, shampoo, shaving cream, all contain PFAS. So it is pretty ubiquitous from all over the place. And we thought we were having, we cleaned up this community. The Board of Health and DPW cleaned up Burlington. 30 years ago and 33 years ago when I got on the board, we said we'd clean up the town, and we're pretty much there. The problem we have is the detection levels have got so better. We were talking about parts per 1,000 and parts per 10,000, parts per 100,000. Now we're talking about parts per trillion. So every time we look and get closer, we find we've got to do more cleaning. But this community took it on head first, and specifically this board. And we're here now saying we're getting there very quickly.
How many parts per trillion or billion does the US government say is safe?
I believe it's 70. is that
They have
right,
an
John?
advisory level of 70 parts
Where
per,
are we at
parts
right-
per trillion.
Where are we at right now, per trillion?
The ones in Burlington,
Yeah.
40.
40.
So we're
So
below
we're
we're below the advisory level of the EPA, which is not a mandated
So we
limit,
spent $15 million and we're already below the level.
But not the state level.
not the state level. The state level is 20.
So, and it's got to be. We gotta clean the water up. But this is what we drink. It's our coffee. It's everything we put in our mouth. It's what we're doing, and we're doing it. Soon as we realized you couldn't measure parts per trillion 10 years ago. Doctor, no, 10 years ago, 5 years ago, parts per trillion. That's like a drop in the whole town of Burlington. It's so small. We couldn't measure it. I mean, as a graduate student, I was happy to get parts per million, and now trillion. That's many, many, many more zeros. So, but at least we're figuring it out.
One has to wonder if it's parts per trillion, if it's harmless.
Well, Doctor, did you want to address that, or?
No, I had 2 questions.
You can't feed it. You can probably feed it to animals and look at them, but that is, what usually happens is they look at communities, they look at large batches of data, and they draw inferences. And if the EPA says that we need to do it, and the DEP says we need to do it, it doesn't make any difference whether it's harmless or not. We have to certify the water. The Department of Public Works has to certify the water in this town. The Board of Health does not, and we have to go there. Just keep it H2O, a hydroxide.
And,
Yes.
the company that's hired, they already have proven, they've already done this in other?
Yes, where have you done this in other, and would you like to make comment?
Yeah, so we are currently doing it for the town of Acton, Devens, and it's been tested in other communities. But the granular and that's in Massachusetts. That's where we have experience. However, PFAS is something it's an emerging contaminant, but there are technologies that are proven for removing PFAS, and granular activated carbon is one of them. And there's extensive experience out there by manufacturers with GAC. The alternative is an ion exchange resin, and we're also testing that in case the levels are getting through the GAC media. But these are proven technologies. We've worked with this media. This media has been used in water treatment facilities all through Massachusetts because it's a media that's proven for taste and odor control. So it's in a lot of surface water treatment plants. So we do have a lot of experience with that for other contaminants. So it is, it's something that we do have a lot of experience, and it's proven. And we've reviewed. John had mentioned earlier, we have an additional challenge right now due to COVID, and there are challenges with these regulations being put in place because all communities in Massachusetts are, a lot of them are facing the same problems that the town of Burlington is facing. So getting the equipment, getting the labs to turn around tests quickly, all of that is a challenge right now, and the town of Burlington is advancing things by putting that equipment and getting that testing out on the street sooner, because procuring that equipment is very challenging right now due to COVID and due to just the demand for this equipment and getting it installed. So so it's something that we're working towards aggressively to meet your needs.
Does the technology have to be upgraded yearly, or is there a?
No, the media does need to be replaced. So the PFAS gets absorbed by that media, and once it absorbs to its limit and you start to get breakthrough of PFAS, that media needs to be replaced. So we're doing, in addition to a scaled version of this treatment system that's currently in operation at the Mill Pond Water Treatment Plant, we've sent out drums of water to several media manufacturers who do testing that's approved by the EPA to scale it down and determine the lifespan of this media as if it's in operation for several years. So that's being done as well. And that will give us an understanding of when that media needs to be replaced, knowing that we're kind of being very conservative in our design. We're designing very large vessels. These vessels are going to be 25 feet in height. So there's a lot of media in these vessels, but that's to provide you the barriers you need to be able to remove that PFAS before it even goes into a second vessel that's just there, just in case you get some breakthrough in the first lead vessels.
Does the media leach into the water when you're cleaning it all? Or what is the media?
It's granular activated carbon, so it's almost like a charcoal based product, and it absorbs that contaminant to it, and then the only way to remove that contaminant is to essentially remove the media from those pressure vessels and destruct it. And by doing that, you can regenerate that media for reuse at other locations, but you essentially have to heat it up to a certain concentration, or to a certain temperature, I'm sorry, that then destroys the PFAS compounds.
Mr. Sanchez, I just want to make sure, have you seen all of the conditions that the board has placed?
Yes, we've seen
Are
it.
you okay with those conditions? Especially condition number 1, which is the one that was the only sticking point that we had in the discussion.
Yeah, no, we're perfectly fine with that as
It
well.
was just, is that's what you're going to do? Apparently, at this point in time, The only real sticking point we had was the detention basins and retention basins that were sitting accessible. They're not really that accessible, but accessible, and you're gonna be fencing those appropriately to keep anybody from climbing into them. Okay.
That's correct.
That's correct.
That is correct, yep.
Does any of the board members have any questions? I know you've seen all these plans. Director,
No questions? No?
our environmental engineer,
No.
are there any other questions for? With that, I'm looking for your interest.
Mr. Chair, I make a motion to approve the site plan and special permit for 70 Winter Street, Mill Pond Water Treatment.
I have a motion by Dr. Sullivan, second by Mary Beth Welch, to approve the site plan approval special permit, 70 Winter Street, Mill Pond Water Treatment Plant. Is there any other discussion? If not, I'll put that to a vote. All in favor?
Aye.
Aye.
That's 5-0. That's it. Thank you so much for coming.
Well, thank you very much for having us tonight.
Thank you very much, everyone.
All right. Seasons 52, 6 Wayside Road, reduced oxygen packaging. Would you please come up here and sign in? Please print your name so we can. Our health agent, Marlene Johnson, will present this to the board.
Sure. So, Mr. Heavenstrait, did I say that?
Correct, yep.
Okay.
Thank you.
You're welcome. He's the general manager at Seasons 52, and they would like to use a cook-chill process, which is a form of reduced oxygen packaging. You might recall Yard House and Eddie V's have come before the board. They're actually all related through Darden. So Seasons 52 would like to use the same process. So what they do is they cook food. In their case, they're going to use soups and sauces. So they're cooked, and then they're bagged hot. Then they are chilled, and then they're stored under refrigeration until they're used, not to exceed 7 days. Their shelf life is shorter, but according to the food code, it can't go past 7 days of use date. Once they need to use it, they reheat it to a certain temperature, and then they hot hold it. I have seen their HACCP plan. They did provide that to me, and I did approve it. And I also was out there this morning to check their logs that they have on site, because I plan to start using this tomorrow. So my recommendation to the board is to approve the variance with the following conditions. The HACCP plan should be followed, and use of logs as described in the HACCP plan shall be used consistently and on-site for inspection. The HACCP plan shall be reviewed annually and initialed by the person in charge. If there are any changes, those changes shall be submitted to the health department. Employees shall be properly trained and monitored by management. This variance is for the establishment listed on this variance and no other location. This variance is approved for a current owner on this variance and is non-transferable to new ownership. And violations of this variance may result in the temporary suspension of the cook-chill operation, and continued violations may result in the revocation of the variance.
Thank you very much. Yes, sir, your name is, please?
Dan Heavenstrait?
Dave, I'm sorry?
Dan, D-A-N.
And last name?
Heavenstrait, it's Hebenstreit.
Straight, okay.
That's in short.
Thanks. First, for people here and on, a HACCP plan is hazardous analysis of critical control plan.
Correct. Or points.
Points.
Points, not plan, points, okay. So this is what we use, a plan to evaluate this particular procedure. And you have no problems whatsoever, because you recommended we approve. Does anybody have any questions for Mr. Dan? Yes.
I do. So Dan, how big are these bags that you freeze, and when you use them, you know, you take them out of your chill and you go to use them, how long do they sit or can be used? Like, can you put it in the refrigerator, or if it doesn't get used in that day, then it has to be thrown out?
Well, I mean, well, to go back to the beginning, so what'll happen is we'll cook a sauce, or a soup for that matter, and it'll get bagged. So it's getting heated to 165, we'll bag it up. We have 2 hours to get that down in our chill tank to 70 degrees. And then we have another 4 hours to get it down to about 40 degrees, and then within 24 hours, it's gotta be at 38. There are times where we cook something and it goes right onto the line and it's being used in the restaurant. If we do store it, it gets stored in a chill tank. It's monitored. Every hour we're checking it. There is a control bag, if you will. It has an X on it. That's the last bag that will go into, say, a batch in the chill tank. And that's the bag that will be temped every hour to make sure it's coming down. If it doesn't come down, we have an option. We can discard the bag. We can start over again. But again, it's in the volume that we do and what Yard House will do, or even Eddie V's, it's very rare that we even have anything left over by the end of a given day. It's pretty much, it's used up in a day and it's gone. It gets reheated to 165, and then we typically, I've never seen us hold it any less than like 140, 145 degrees. But it gets used very quickly typically. The bags, I mean, we will certainly never put more than a gallon into an individual bag, but honestly, most of ours are smaller than that amount. So we've never really run into a problem in the past, and Olive Garden's used it prolifically. And we have pretty, because of the size of our company, there's a lot of communication that's very rapid. So if there's a problem in the process at another brand, for example, we'll get notification of stuff. Hey, look out for this, or we'll get reminders and whatnot in any of our processes. Yep. And that's one of the good things about being part of a large company.
Thank you.
You out there who had to learn this as I had to learn this, you know, I cook something, I throw it in the freezer.
Yeah.
We don't do that anymore. That's not what you can do. There is an absolute plan that you have to lower the temperature and raise temperatures in certain ways in commercial kitchens. So after Thanksgiving.
Oh, David has a question.
David.
Yeah, thank you, Mr. Chair. Can you guys hear me okay? I think I fixed my mic.
Yes.
Yes.
Okay, great. This is a question for actually Marlene. So I'm just curious, this is only about a year or so in the town. How have the other Darden restaurants managed this process for us, okay?
Yes, so what I've done is I have a HACCP checklist that Samantha and I use when we go out to these establishments. So that way, these are actually designed from their HACCP plan. So we're pulling the information from their HACCP plan and putting this on our checklist. So that's how we're able to check them. And the other restaurants, we haven't had any issues.
Awesome, thank you.
You're welcome.
Any questions from anybody? If not, I'll entertain a motion.
Motion.
Andrea Sheehan made a motion to approve the variance. Let me see if I have it right. The Seasons 52 6A Wayside Road Reduced Oxygen Packaging ROP. Is that correct?
Yes.
Do I have a second? Second by Mary Beth. Any other question? Any other discussion? If not, all in favor? Aye. 5-0.
Thank you.
Thank you for coming.
I appreciate it. Thank you very much.
How long has Season 52 been here?
Oh, I think, wasn't there for the opening. I think we're about 9 years now.
Yeah, 10 years. Yeah, it's been 10
Yeah.
years.
It's amazing.
Yeah.
Thank you so much for coming.
Thank you very much.
Happy holidays.
You as well.
All right. Our next discussion, and I'm assuming that everybody's here to listen to and to possibly participate in the possibility, actually for mass mandates for Burlington. I know that we have all received more than a dozen comments today. Susan, how many? About 17 you said came in today?
I'd say probably 15 to 17.
15 to 17, and what was the final case? How many for mandate? And I'm just
Out of the total, I believe there was 2 and then one letter that we had that was for, and then the rest were.
15,
against
16.
it.
Yeah, the overall majority was to not have a
No
ban
mandate. Now, we're gonna talk about this, and please, we're all from Burlington here, we're all adults. I don't wanna get into a yelling match. I know that for some people, this is a very sensitive issue. For some people, it's an issue of freedom. For other people, it's an issue of health. And for me and the whole board, it's an issue of concern for the community, one way or the other. And there are points which are very, very good to keep it, to develop a mask mandate, and I know that there are a lot of others not to. So let's try to be nice to each other tonight. I know in some areas this does not happen. So can we all agree? Say yes, please. I make me feel better. All right. We've talked about this a number of times, and we know what mask mandates are. We know that some communities have done them, some around us, some not around us have done them. So I would like to talk about the possibility, and I'd like to start it off with a board member who's also a noted physician and scientist. It's very important that we have, that we have Dr. Wayne Salzman, who is he's a medical doctor, and he's a PhD. He's an MD, PhD, and Dr. Salzman is a member of this board, and he's a member of the board first and foremost. But he does have substantial background, and I have asked him to sit on a subcommittee to monitor what's happening with COVID, along with our staff and myself and every other member of this board. But we're going to have Dr. Salzman speak first.
Thank you, Mr. Chair. You reminded me that my wife says I sound much better on paper. So thanks for that. So this is an ongoing issue that the board has contemplated for quite some time. I think it's fair to update everyone that as of today in Massachusetts, over 1,400 people are hospitalized. Over 300 of those folks are in the intensive care unit. Over 60 people died within the past 24 hours from COVID. And we have over close to 800,000 folks who have died in the United States. So for people who were naive like me 2 years ago and said, oh, this is just another flu, it's not another flu. This has become a partner with us and has remained significant. The Board of Health, let me just say, Mr. Chair, as you know, I've been a member of the Board of Health for 15 years, and 7 of them I was chair. My predecessor, and during my stint, and now you, have made a commitment to the town of fairness, transparency, openness, and our board has been committed not just to our citizens who live here, but also to the retailers, to the businesses that also are here. We received a number of emails and texts today. I've reviewed them all. I want to assure everyone who sent us a message that their voices have been heard. For those who recognize the work of our director and our staff, let me just say the tireless work of our director and staff over the past 20 months. As part of their comments, that's very much appreciated. For those who made comments to the board that intimated that the board, that were more anger-related and I'll just say inappropriate, I understand where everyone is coming from. This is a very stressful issue. This is a politicized issue. I understand that. I'm wearing a mask because I believe that I should. I was at the mall this weekend, and the majority of people were not wearing masks. I go to the market, it's the same. It's become a contentious issue. So and because this board is not a politicized body, but it's one that upholds the regulations of the state and also has its deepest interest in the public health, my comments or my recommendations to the board are not based on politics, they're not based on liberty, they're not based on enough is enough, they're not based on, come on, seriously, aren't we done with this? Because we're not. So the CDC 6 days ago recommended that folks should wear masks while indoors. The Mass Medical Society today recommended that people should wear masks indoors. We know all about the Delta variant. We know about the Omicron variant. We're learning more about it. Leaders like Dr. Fauci were rather sober. My concern with a mask mandate, Mr. Chair, is that we can't enforce it unless our town administrator and the selectmen of the town wish to instruct our police force to respond to our malls, our markets, our independent retailers when someone's not wearing a mask for a mask mandate. It's just not going to work. What I do believe in is education. I believe in responsibility of our citizens to each other. I believe that folks should wash their hands. I believe that folks should maintain fair distance, even if they're vaccinated. I believe that folks should become vaccinated if they can. And I believe that folks should use their own common sense, knowing what we know, knowing what we've seen on TV, knowing what our hospitals are currently dealing with, to take every precaution to make sure that they and the community are safe. But I can't envision mandating it. I can only envision making it a responsibility and a recommendation to do so. I'll stop there, Mr. Chair.
Thank you. My vice chair is online, and since he's vice chairman, the subcommittee chair, vice chairman, please, vice chairman, which is David McSweeney, I'd like you to speak, please.
Yeah, thank you, Mr. Chairman, and thanks, Dr. Saltzman. I couldn't have said it more eloquently than you have, and certainly your medical background helps support the decisions here, because it's not just a decision on whether masks work or not. I think, and it's funny because you're right. I think in a lot of the emails and texts that we received today, a lot of them saying that it doesn't work. You know, masks do prevent the spread or help prevent the spread. It's not the magic lining or the silver bullet, but certainly it helps. So does in distancing and washing your hands and getting a booster, right? All those things. But I think and Mr. Chairman, thank you, I guess, for putting this on the agenda. I think we do need to continue as the pandemic continues on. I think this is our job. This is the duty of the board to continue talking about this and to continue evaluating this need as well as other needs that help support public health in eliminating the pandemic or reducing it, the spread. I can just say that we've talked about this several times. My stance hasn't changed. I don't see a mask mandate in the town of Burlington working. And I know some of the surrounding communities that have instituted mandates have backed off. Some have reinstituted the reinstitution of them. So they go back and forth. They're just hard, very hard, as Dr. Saltzman said, to police and manage. I think, our staff is better served focusing on other parts of the pandemic than worrying about, Mr. and Mrs. Brown resident didn't wear their mask in a restaurant. And what does that mean, and how do we track that and penalize them, because there is no penalization that we can do. So I just am not in favor of a mask mandate. There's a lot of good to wearing a mask, there is some, craziness around as well. And I think at this point in time, Burlington has done a great job in the vaccine. We have a high number of residents that have been vaccinated. I would, push, let's, keep distancing, social distancing. I think if there are instances you're in a crowd, you should be wearing a mask. But a mask mandate at this point would not do anybody any good. So I would not be in favor of a mask mandate.
Either of you would like to speak?
Mary Beth?
I think they said it best. I think the words recommended, suggest, you do what you feel. I think they said it best. I think it's fine. Thank you.
Andrea, Ms. Sheehan?
I have mixed feelings on it, Mr. Chairman, and that's because I know it's difficult to wear a mask, but I also feel like the numbers are just not going in the right direction, and anything additional that we can do to prevent the spread is something that we should, really consider. It doesn't have to be indefinite. It could be, for, a short period of time, but I just see this getting worse, and I just don't see an end in sight. So I feel like I'm willing to do my part, and I think it's important that others do, but I think when it's a mandate, people do adhere more so than if it's their choice.
Okay, thank you. I'll reserve to speak at the end. Susan, you are Director of Public Health. I know you have strong feelings about this. I know you're out there in the community. As I have said to the selectmen and this people within this community, you are the unsung hero of Burlington, and I know you get upset when I say that, but nobody works 7 days a week and continues to work 7 days a week to keep this community safe during this COVID situation. It's beyond pandemic. So what would you like to say?
So I would say I agree with Dr. Saltzman and Mr. McSweeney. And to add to that, I don't think a patchwork way of masking is going to work. It's not that I don't believe in masks, but I think if it is going to be done, it should be done on a wider scale. We don't, people who live in Burlington don't stay in Burlington. We cross border lines, and we're going outside of Burlington and people are coming into Burlington. So I don't think just having sparse communities with a mask is going to make a difference. I do feel like what Dr. Saltzman said about the enforcement is an important point. We cannot enforce it, especially now in the height of the pandemic when we had a state of emergency. We were tasked with enforcing it. It was extremely difficult, and we spent a lot of time doing so. Now that we're back to semi-normal and everybody is going everywhere, we're now back to our normal duties. We're doing food inspections, we're doing hazmat inspections, we're doing housing inspections. So I don't see how we would be able to enforce a mask mandate as well as do everything else that we're tasked with doing. I think Andrea does have a point. I think maybe there are some people who see a sign outside and say, oh, there's a mask mandate here, I'll go grab my mask. But then you have other people who just are not going to do that. I do believe that it's situational, so I think, and I believe in personal responsibility. So I think everybody needs to decide for themselves, when should I wear a mask? Am I vaccinated? Am I unvaccinated? And what situation am I in? Am I in a crowded place? When I go into a retail store, I always make sure I wear a mask. And it depends on where I'm at. So if we do institute a mask mandate, then that means that we're gonna have to wear masks in our public buildings. Well, there's nobody in my office, there's nobody out in the hallways, hardly ever, and I'm able to keep my distance from everyone. So mandating a mask, I think in that situation, just is not feasible. It's not, I think people need to make their own decision about the situation that they're in. And then lastly, I think I would say that lifting a mask mandate, if you put the mask mandate in, you have to think about when you're gonna lift that. What are the indicators that we're looking at here to say, okay, now it's time, we don't need a mask mandate anymore. I think COVID is staying with us, It's going to be with us for quite a while. I think people need to get used to it. And I agree with mask wearing. I think people should wear masks in crowded places, whether vaccinated or unvaccinated, and they should continue to do so long as COVID is here.
Thank you. I'm going to ask anybody, other staff members. Would you like, anybody else? Would you like?
I mean, if a mask mandate comes to the town of Burlington, I'm saying right now, I do not endorse the Board of Health enforcing it. It will not be the Board of Health that's going to enforce. It's not going to be a Board of Health that's going to get a call from a retailer saying, somebody in my store isn't wearing a mask, come and do something. That is not what the Board of Health is all about. So if, that being said, if individual retailers want to put a sign in their window, as many have, saying masks are required here, I support that, absolutely, absolutely. But, and I think the other thing that our town has to realize, and Mr. Chair, you know these numbers, but you know, right now there's 27,000 folks in town of Burlington. What happens during the holiday season? 10 times that? So we have, you know, 27,000 people in our town. I think it swells to
200,000.
to at least 200,000 during the holiday season, and then it swells a number of times just from people who work here. This isn't just about the, you know, so I think the town of Burlington needs to be responsible and needs to remember that we are a huge commercial base, and people are coming here who may not be as diligent as we are, and we need to think about those things. But to the letter we received from, and I don't even know if it was I don't think it was a resident, saying, I come to Burlington because there's no mask mandate. What a pleasure to shop here. Really? Really? So, anyway, enough said. You should wear a mask. You should wash your hands. You should socially distance. You should not go to work or expose yourself to others when you're not feeling well. We know these things. We've talked about them. We're educated. But I'm not going to force people to do that.
Thank you.
Enough said.
I'm going to ask anybody here, we have people here who came to hear this, and this is a community. It's my community, it's your community.
Mr. Chairman, we also have people, at least 2 online.
Okay, well, let's 2 people here first. They got in their car and they drove over here, or they walked here. Does anybody want to say anything? Do you want to add? Please come up, sign in, and I mean,
I'd like to say something if you want me to come up there. And sign in.
please come up so that you can be seen on camera. Please sign in so we.
My hitter's a little messed up, so.
It's okay, it's fine, just print, please.
I'm Doug McKinnon, been here 25 years, love Burlington. And I couldn't agree with what's been said here anymore. I think it's past time that we lift the mandate or we don't reinstate the mandate, because we are retail. That's what we are here now. Sure, we've got some big anchor companies like Oracle and some other companies like that, but we make our money through retail. Just to give you a quick example of sort of the craziness of the mandate. I would go to a restaurant and I was told I have to wear my mask until I sit down. And then I can take my mask off as if COVID doesn't exist anymore at my table. It's just, it doesn't make any sense whatsoever. I mean, my server could bring it to me if she has it. She's got her mask on, which is good. But look, life is a risk. We're not guaranteed tomorrow. And that's really all I have to say. I'm very thankful for the comments here today. Thank you.
Thank you. Would anyone else like to speak here? I'm giving you a chance before I go on ask people on television. Obviously, there's 1, 2, 3, 4, 5, 6, 7 people here, and nobody's wearing a mask, so I can surmise, and I'll be wrong. You know, I always make them wrong this way, that you're all not for a mask mandate, but
I respect your comments and your feedback. It's very.
I will now ask if anyone online would like to speak. Director?
So I believe we have two people online. Carmela, Sherry, Jeff, any of you would like to speak?
Okay.
You know,
I'll
speak real quick.
We
I
had-
just wanted to say thank you so much. This is Carmela. I just wanted to say thank you so much. I really appreciate it. Everything that you're doing for the town of Burlington. I've been here for 12 years, and I love Burlington. And I think what you're saying is absolutely, I'm 100% with you on that, which should be something that people are um, should be responsible and do that, wear their mask when they're sick. So for example, today I was planning on coming to the meeting. However, I'm not feeling well, so I stayed home. So, I could come and wear a mask, but then to me, it made sense for me to just stay home. I come from a country that, we didn't have freedom. And that's why I'm here in America. I want to make sure that my family and myself have freedom. We're all, adults, and we should know what we need to do. If you're sick, stay home, wear a mask when you need to, and wash your hands, as you mentioned, doctor. So again, thank you so much for all you do. I really appreciate it, and I really am thankful for everything that I've heard this afternoon. Thank you so much.
Is there anybody else on TV?
In TV land, as they used to say.
Hi, may I speak?
Sure.
Sure. Who are you, please?
Hi, Jeff DeBona, Town Meeting Precinct 3.
Good.
I was asked to speak tonight by members of the community. They, resoundingly, I've heard a lot of, we don't need a mask mandate. People can be self-responsible. It's going to hurt businesses. And you've seen nothing different in other towns that have it, such as Billerica, right next door. They have a mask mandate, and their numbers are terrible. So it doesn't seem like helping anything. And that's the consensus I've got from a lot of people around town. So thank you.
Thank you, Mr. DeBona.
Anybody else? Well, I got to tell you that I am concerned about the community. I'm concerned about what's going on here. I'm concerned about the numbers. Our numbers are skyrocketing. How many people did you get in today? Lots. Lots today.
So over 10 yesterday and over 10 today, and more people calling.
And I know this is not very popular, but I'm starting to think about maybe. I just worry about my kids. I worry about your kids. I worry about everyone in this community. I've lost friends to COVID. I've lost friends, and I was on the fence, but I feel that maybe we need to consider a mandate, and I was really interested in coming here and see how everyone felt. So I'm maybe on the other side of the road here, but I do understand. I have great respect for everybody, and thank you for coming. Thank you for, unless I have a...
Can you speak a little bit on enforcement? I think Dr. Salzman brought it up.
Let me tell you about enforcement.
You brought it up as well. I'm sorry, I forgot your name.
There is no enforcement.
But it's very difficult. You're making the owner, the proprietor of the business, you're turning them into the police.
Well, here's the...
Yeah, but we're not necessarily talking about the owner of the business. We're talking about Mrs. Smith is walking down an aisle at Market Basket and sees somebody not wearing a mask and calls the Board of Health and says, come take care of this right now. Or says to, the kid who is managing the cashiers and say, hey, look at that. That person's not wearing a mask. You need to take care of that right now. It's just, it's just not tenable. It's just not tenable. Now, let me be clear. Right now our hospitals our frontline workers are really suffering, and I know that they would be saying, and I'm not a frontline hospital worker anymore, but I know that they would be saying to me, we need a mask mandate. You got to help us. You got to help us do something. And I get it. I get it. And one of the mayors at a town not local to here in Massachusetts said, you know, this is the only way to maintain enforcement is to have a mask mandate. And it just doesn't make, it doesn't make sense to me for our town. And that's all I'm saying. You know, the fact that you're here, the fact that you're all here, the fact that we got letters, it means that our folks are involved, they're educated, they want to talk. I appreciate all of that. It's a really, really hard decision. And I'm sure as a doctor, I'm not going to be too popular for saying it. But, and I respect Dr. Weiner, what you just said. But I just, you know, this is something we have to live with, we have to deal with, we have to be responsible for ourselves and for our fellow citizens. So that's how I feel.
I just want to talk to you about enforcement. From day one, 20 months, as soon as we had the mask mandate, the police said, we're not going to enforce. We're not going to enforce. We're not going to do that. We're not going to do that because we have to protect the people in the community for real physical harm. We're not going to do that. Members of the fire department, there are some, and for all departments, who are not yet vaccinated. We can't force them, at least not in this community. That's a selectman issue to enforce them. I spoke today to the chairman of the selectmen, asked him how he felt. He said, can't force it, what are we gonna do? They call here, we can't do anything. We are here to ensure public health at a much higher level, and we just can't do that. One of the largest public health groups in the Commonwealth here is in Burlington. I get it, and we heard so much what they're doing, all of them are doing, just to keep us safe at every other level, and when they can't enforce. And I hear from other communities. I spoke to a mayor yesterday. Again, can't enforce, does not what to do. We got to be responsible. It looks like I feel that maybe we need to go for a mask mandate, but clearly the community doesn't want it. The board doesn't want it. Unless I hear from a motion to bring this up and vote on that, I don't see any. Then we can't vote tonight. We won't. But that does not mean, and I want to assure you, that does not mean we're not going to keep an eye on this. We've got another meeting this year. Hopefully we won't need it. Usually that's the one meeting we can skip, the one right after Christmas.
I mean, this is a continued discussion. It's a continued discussion with the board. It's a continued discussion with the town. We want the town to weigh in a collegial, respectful way. We'd like the town to weigh in. We want to hear it. You guys elected us to be responsible for maintaining the public health of this town. We take that very seriously, but it's a relationship. And so thank you for being here. Thank you for the folks on the phone. Thank you for people who emailed us. And we are going to continue to talk about this. And I'm glad we are,
If we meet in December, we can put it on again.
We have someone else who would like to speak
Can you just hold
online.
1 second?
Okay.
Does anybody want to make a motion on anything here? If not, we can just leave this as a discussion tonight.
I would just leave it as a discussion for now.
Mr. Chairman, can I also add something to the enforcement part of it? Because this came up a lot when we were trying to enforce it, and we had all of our staff working on it. It's not only that they're not wearing a mask, it's that they're not wearing the mask correctly. So they got the mask, but it's halfway down their face, or it's falling down off their nose, and we had people complaining about that as well, and having to look into those types of things. So that's another issue with the enforcement. But I'd also like to add too, I think it's really important for people to understand the isolation and quarantine requirements and guidelines. And if they have any symptoms at all, like this woman on the phone, stay home. That's the most important thing. And symptoms can be just like a little runny nose. Stay home, get tested, take a home test if that's what you have to do, and then know what you're supposed to be doing for yourself and your family members. We have information online on our Board of Health site on isolation and quarantine. I think people are getting that wrong all the time, and they're going out before they should be. I'm feeling fine now, I can go out. No, you're contagious for 10 days, plus anyone who's exposed should be quarantining for a certain period of time, as well as household members, unvaccinated household members would need to stay in quarantine longer. So if anybody is confused about if they test positive in the isolation and quarantine requirements, they should call us. I think that's one of the things that we really have to stress, is that people should not be going out with any type of symptoms.
Thank you. I'm going to ask one other. Do they have mask mandates that are enforceable in Minnesota?
We did go through the mask mandate in Minnesota at the beginning of the pandemic, and it was a nightmare to try to enforce. We had police and Department of Health workers out and about. It was very difficult. I mean, when it was all we were doing, we were barely able to keep up on that. And then once things sort of got back to normal, the mask mandate went away. We still got a lot of questions about it. I think there was a lot of misinformation out at the time, but it stretches us thin on something that may or may not be very effective. I mean, we had the mask mandate. You didn't see any flu the last few years. So masks do work, but I would push for more vaccinations. And if you feel you're sick, like Susan said, know the rules, stay home, quarantine and isolate yourself until you feel better.
There is a mask mandate in our schools. I just wanted to.
So how does?
And we have the one person online too. I just
Sorry?
don't want to forget about.
Which?
Would a no vote today,
Overturn what? I'm sorry, sir.
the schools?
No. That's a
No.
DESI. That's a state mandate. Case mandate.
So we have Sherry, Mr. Chairman. that would-
Sherry, please state your name and.
So I'm sorry, Ms. Ellis, 1 second, please. I just wanted, Mr. Chairman, because I did see, just to piggyback on that last gentleman's comment, because I did see a couple of references to the school mask mandates. And maybe I misread it, but I got the feeling like they were implying that those were our mandates for the school system. So I want to make sure that it's clear that that is a state mandate, and that's driven by the school committee, not by the Board of Health. But that is a state instituted mandate, not town by town. So I just want to make sure it's clear, because I think I saw that in a couple of emails today as well.
But what we do know about what happens in the schools with regard to that, the schools do mirror the community. So our community has to be responsible for the sake of keeping our children, even though they're masked and distanced and all of that, have to keep our children healthy and safe as well. So this is a responsibility based on education, communication, and citizenship.
Sorry, Sherry, you can go now.
Sherry, the chair recognizes you.
Thank you,
Sherry,
Mr. Chairman.
please I know who you are, but please state your whole name so everyone does. Sherry Ellis.
Thank you, Sherry Ellis, a town meeting member from Precinct 3. And I just wanted to state that I appreciate the members and the staff's comments tonight. It was a very good discussion. I will say that I would tend to myself to be more on the side of mandating a mask. However, I understand that it's very difficult to do. Being a member of the Zoning Bylaw Review Committee and knowing the zoning bylaws, they are hard to enforce too. So I understand about enforcement. I also don't think that's a reason to not do a mask mandate. But I do appreciate all these comments and Dr. Saltman's comments. And what I really would like to say is you folks are great at educating our community. And I think that leading by example and perhaps maybe not a mandate is the way to go, but maybe recommendations and maybe making more public recommendations, especially within our municipality buildings. A statement on the doors that say, here are our recommendations for, what a mask does, just educating us more visibly instead of having to go to your website and learn about some things. Maybe if there's more education on entrances to buildings, no mask mandate, but here's what a mask does, protects your fellow residents. Maybe something like that could be considered instead of, dictating a mandate or something like that. So that was just some of my thoughts.
Ms. Ellis, I spoke to Mr. Tiggs tonight.
Chairman of Selectmen, and we talked about that, and he wanted to know if I had budget for that. And I said, well, I'm sure that the Selectmen has budget for that more than the Board of Health has a budget to put those posters together. And he is going to approach the Selectmen in the next meeting about creating those types of posters and paying for their creation and publication and offering them up to all of the businesses in town as the town of Burlington recommends. So he is already on that. We talked about that, and he asked if I had a big budget for COVID, and I don't believe we do have a big budget for COVID.
Ms. Ellis, thank you. I am totally in favor of what you have discussed, and, God knows, I went on BCAT for 12 weeks straight, advocating for all of this, and I never know what the outcome was of my doing so, but as I've told everyone, I am delighted to come anywhere and talk about what we can continue to do together to maintain our health and our wellness in our town. And yes, you are absolutely right. Visibility, consistency, transparency is really what it's all about. And I completely agree, and I advocate for that. And I think that people respond to that.
I think this board has been very outspoken. I never realized how many people watched the 11 o'clock news when I was on Channel 7, a number of segments talking about the pandemic and what I thought that the inadequacies in certain parts of our government were. But we'll continue to speak out, and we'll continue to try to do what the right thing is, and we'll keep talking about this at every meeting. So with that, Shari, thank you. Thank you for all coming tonight. You're welcome to stay. We're going to be going through, and since I have no motion, we're going to be going through staff reports, which are always interesting. And with that, thank you. Have a wonderful holiday.
You as well.
Happy holidays. Merry Christmas. Thank you all for coming. Okay, staff reports. I've got my list here, excuse me.
Environmental engineer.
I'm sorry?
Environmental engineer.
Environmental engineering first. Thank you so much.
Actually, it's Marlene. It's Marlene.
Marlene first.
I was looking at Marlene.
Marlene, here it is. It says
twice you
health
skipped
agent.
me.
I know.
That's Marlene Johnson.
Good evening.
It's just so nice to see her here.
So, just to keep you posted, we currently are going through our retail sale of tobacco permit renewal.
Oh, wow.
So we're working on that. And in February, I was asked to do a food safety presentation for the MRC volunteers. So I will be working on that. And Samantha and I started working on the Voluntary National Retail Food Regulatory Program Standards, which is shortened as Retail Program Standards. So this was the program that we applied for grants, and the grants will be distributed in February. These have the 9 standards. And so I'm going to give the board a full report in February, more about that, and kind of give you an idea of what each of those 9 standards are, just so that you know what Samantha and I are working on. And inspections are back in order. We're on our routine inspection schedule, and swimming pools will be coming up next year in the winter, the indoor pools, so things are going well.
Are there any questions? Ms. Johnson?
You let me know what I need to remind you about the chlorine thing.
Oh.
Yeah, because you know that just because you smell chlorine doesn't mean that the pool is chlorinated. We forget that off-season.
Yes.
So,
Chlorine.
I'm happy to,
I have a question.
happy to work with you on that.
Since Dr. Salton brought up chlorine, do you have a lot of pools that are salt now? They don't use chlorine?
A few of them are, so what that means is they're using salt that generates the chlorine, which is a lot safer. There's no chlorine chemical on site, so, yeah.
Is it sodium chloride, or is it?
You put in salt, and there's actually an electrode system
Yes.
that breaks separates the sodium and the chloride, and so you actually have chloride as the sanitizing agent, but it's salt.
Interesting.
It's healthier.
You still test it,
Right.
you still test it the same way too, so
Very interesting.
it's
I don't
becoming
have a
very
pool.
popular.
Yeah, you've got a cranberry bog.
Piercing by pagoda, body art regulations. Are they want to come to town, or?
So I did a review. There's some zoning issues. And so if they are able to get through the zoning and they are defined as body art, then we would have to permit them and regulate them. But at this time, I think they're just doing ear, which ear is allowed. It's not considered body art.
Okay, thank you.
You're welcome.
Any other questions? If not, do I have a motion to approve the health agent's report?
So moved.
Second?
I have a motion by Dr. Salzman, second by Mary Beth Welch. All in favor?
Aye.
Did you say aye?
I did, yes.
Okay, thank you. Environmental engineer.
Good evening. So we have been, with the aid of Sarah Cormarsh, our administrative assistant, one of our administrative assistants, we've been doing the annual septic and grease hauler permitting. And that's for people who haul either septic or grease through the streets of Burlington. We are starting on the January renewals for biological safety permits. Those are all due in the month of January. At this point, nobody has come forward to tell me that they've had any major modifications to their permits, so they'll probably all be renewals versus a board appearance. At the last meeting, I was asked for an update on 207 Cambridge Street, and I did find out that the proposal that this board approved did pass planning board, so the site plan has been approved. However, it did not pass in time for them to get a street opening permit for this season.
Oh, boy.
So work will not be initiated until next spring. But it is approved for that drainage system to go in, so we'll have to keep an eye on it this winter for icing issues as we have in the past several winters. And lastly, I did final inspections at 2 properties on Fox Hill and closed out both those complaints because both properties were in compliance with their orders from the board.
Okay. Any other questions?
So, Mr. Chair?
Please.
So I'm going to channel Mr. McSweeney here. So 207 Cambridge Street, given that situation is not going to be changed for the winter, is there going to be some sort of plan put in place so that either there is de-icing, something that's going to be happening on a regular basis? Because I see the drainage now, which is just the water drainage, but I'm just envisioning what we've seen in the past, and I just wonder if there's a way, knowing that plans are in effect, if we can be more we can urge more proactivity on maintaining safety in that area.
So, once we identified the issue with the property owner, they have been quite diligent about icing that area. I found out recently that the property manager is no longer with the company, but I have a new contact, so I'm going to I just got that contact information today, and I'm going to reach out to that individual and make sure that they are going to be as diligent this season as they have been the last season and a half once we identified the problem with them.
That's great. Thank
I
you.
did go out very frequently last winter, anytime I thought there might be an icy issue, including, 7:30 in the morning, or even on a
Great.
weekend here or there, to make sure they were on top of it.
Great. Thank you.
we're having a warm winter. Can't we order an emergency situation and get that fixed? What allows the street to be open and the street not to be open? Is it the fact that the equipment can't get into the frozen earth, or is the fact that, why all of a sudden on Monday you can open it up and we get this done, and an emergency situation and a terrible situation gets fixed? On Tuesday, there's no more opening up the, who makes that determination? Do we know?
I'm not positive, but I think it would be a Mass DOT decision.
Mass DOT decision.
Because it's there's town requirements on street openings, but then there's also state restrictions on street openings. And since it's a mass highway and they're looking to connect to the DOT system, I think that's the.
Can we petition them to allow it to be opened? I mean, it'd save you a lot of time if they fixed it earlier than later.
I don't know.
Maybe save some people who might skid and whatever. Whom do we call?
So it's like Christine said, it would be the DOT, because they're the ones that issues the street opening permit, based on how long it took them just to get, originally, when they were trying to get just the permissions from DOT, right? Was that what they were doing? It took months and months and months just for that. So I don't anticipate that they're gonna hurry, if the Board of Health, I mean, we can certainly ask them, but I don't see how, we had an order letter out on them. Do we have an order letter on them? Okay. So, I don't know, we could try, but I just don't know if DOT is actually going to hurry it along, or even if they can, based on, I don't know why they don't, I'm not sure what the logistics around, or, if it has to do with the time frame, or if there's other issues regarding a street opening permit.
I think it has to do with the frost season and physical restrictions on digging into frozen ground. But I'm not,
You want me to call our state representative or state senator?
At this point, I don't think that it's necessary. I mean, I think that it was controlled last year through them going out there frequently and doing the de-icing on the sidewalk and on the roadway. I think they like you said, hopefully it's gonna be a warmer winter this year, or so far it's predicted, right? And that maybe we won't even have that problem, but if we did, then they would need to get out there right away and take care of it. And we can, I mean, if they don't take care of it, I guess at that point, we can issue an order letter on them as a nuisance type condition, and, force their hand that way.
On the DOT?
No, it would be on the property owner to take care of the situation, not on the DOT.
Okay. Well, if you'd like me to escalate this, I'm good at escalating.
We know that.
Except to the governor. But I'm good at escalating, all right. That's, one other question on Barnum. No rain?
we got about just under an inch last week, or no, this weekend, and I had no feedback on that.
Okay.
We got about 0.9, I think, over Saturday into Sunday.
And no issues?
No, it's been left that if there's an issue, call.
Okay, all right. Do I have a motion to approve the environmental engineers report?
Motion to approve.
I have a motion by Andrea Sheehan, second by
Second.
Mary Beth Welch. All in favor?
Aye.
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 Okay, 5-0. Our next is Director of Public Health, and that includes staff reports from the supervisory nurse, as well as the associate health inspector, Samantha Hardy. So let's do the associate health inspector first. Does anybody have questions?
Mr. Chair,
Yes.
with regard to the food inspections director, I was just wondering, given the establishments, were the violations anything to do with maintaining rice? maintaining sushi rice?
I don't know what each violation was for each
I
establishment.
don't know either. It just says violations corrected.
Yeah.
So,
I mean, unless the board wants us to put down a specific
no,
violation.
I just, you know,
Marlene, do you know if any of them involve rice?
What's the establishment name?
so it's just the pattern.
Oh, okay. I do know that this one, she did, and they corrected that on site for her.
Okay, all right. The health agent has explained to me, and
Okay.
I'm better now.
What does correction on site mean for sushi rice?
For example, if they didn't have the pH listed for that day or that hour, then we would have them do it in front of us.
Okay, so
So
we're
they
not
would correct
talking
it on
about,
site.
you go in, there is no, I would assume that in those cases, if we went there and there was no pH meter, no pH paper, and the person
That
doesn't know how to do it, you'd shut them down.
That'd be an immediate, that'd be an imminent health hazard. We would suspend that operation and then give them 72 hours to get it in compliance.
Okay. All right, the second is the supervisory nurse, Christine Pollock. Do we have any questions about her report? I have one on AED checks, and if an AED is not working, whose responsibility is it to get it up and running?
So the AEDs that we maintain, it would be our responsibility, but we don't maintain all of the AEDs in town. So there are some AEDs in town that are maintained by the fire department. We don't check those, and we don't make sure that they're in working order. But if it's an AED that we're responsible for, which goes back many, many years to
We
to a
worked on
town
that.
meeting, it was when Wayne was chairman at the time when we started this discussion, you know, what we should do with those. But if it is one of the ones we're responsible for, we make sure it's in working condition. So we purchase the pads, we purchase the batteries, and she checks them on a regular basis to make sure that they're working properly.
And I think we're in charge of 5 in the municipal.
Yeah, and the Ice Palace is one of them as well. So we have the Ice Palace, one at our building, we have a portable one. And then we have, a few other, the library is another one that we.
And are
do.
we responsible to replacing them if they go down, oh, that hasn't
We've
happened
never, that hasn't happened.
in a long time, yeah.
Yeah, so, I don't know. I mean, if that happened, I guess we could look into how much that would cost and where we could get funds for something like that, but, yeah.
Thank you. Okay.
The supervisory nurse has been extremely busy with the COVID cases. She's doing an amazing job, and she's on top of all of the cases, especially with the schools. So I've been supporting her a lot this week and actually the past few weeks, where it's just when the cases have been picking up, we're prioritizing the schools. And so she spends a lot of her time talking to parents, talking to positive cases, talking to the school nurse, doing the quarantine list for the schools. So she's very busy with that.
And do you have the volunteer nurses, is it
So-
to the level that she needs support, or?
Well, so we do have the intern Harrison coming in. He has finals this week, so he's not here this week, so it's been a little tough without him. But we do have some MRC nurses who are on board, although when we were deprioritizing, so last week DPH said, oh, you can deprioritize now because they stopped the CTC, and they said deprioritizes your cases to basically school-related cases only. So I had some MRC nurses trained, and at the time I'm thinking, well, okay, well, we can handle that with Chris and Harrison, but now the school cases are picking up as well. So I may go back to the MRC nurses. The only problem with that is that they can't get onto Maven because you need like a town-issued email address to get on, and it's a lot of training and maintaining and things like that to actually get on to Maven. So they have to do everything in paper. So if they're doing it on paper, we still have to enter into Maven at the office. And when we're talking about a school case, we want to get to those right away. So, you know, we want to get to it, see if the kid was contagious while they were in school. And if they were, get the school working on trying to identify the close contacts and get them into the test and stay program. So sending it out to an MRC nurse who's going to get to it when she has time is very difficult.
Okay. Last is the Director of Public Health. Any questions for the Director? I have a couple.
Okay.
Many calls. Has to do with the summary conflict of interest law for municipal employees. We have to review all that information.
Yeah.
I just want to remind everybody, and do we have to submit it to you or to the clerk that we have reviewed them?
Town clerk.
Just send her an email?
Yeah.
Okay, so please do
No, it's not
that.
the town clerk's email, it's another email.
Whatever they came from.
It's another email, it's not Amy Warfield's email, there's a different email.
Okay.
Which is included in the email that she sent out there.
Yes.
We all have them.
Yeah.
Yes.
When I sent it, it says in that email.
You do not have to be a full-time paid municipal employee to be considered a municipal employee for conflict of interest purposes. Anyone performing services for a city or town or holding a municipal position, whether paid or unpaid, including full and part-time municipal employees, elected officials, volunteers, and consultant, is a municipal employee under the conflict of interest law. Does that include MRC volunteers?
So I I think Amy and I had this discussion before, and I think that it did not, but I'll revisit that with Amy and ask her that question again.
Okay.
Sure.
So
We don't send that out to volunteers, and I don't know what would happen if they didn't do it, if they could not be a volunteer anymore, I'm not sure.
Okay. Are there any other questions for our director?
I do just have one thing to add, just to keep the board informed. So we're starting to think about the health fair. I'd like to do it again, although I'm leery about having an indoor event at the high school the way that we normally have it. So we did meet with the recreation department about collaborating and teaming up and having a health and wellness type of activity on the town common and having it outside. So we're working with them, and they have some great ideas. They have a fitness person that's gonna bring classes and have demonstrations, plus we'll have our regular health fair people. And because it's a collaboration with them and because it's outdoors, we're hoping that, you know, we'll have even more people come to that type of event. So we just met with them the other day, and I think it would be a really good program for us to continue, and we're thinking about doing it in May. Because that works out best for.
I would think a late May.
I think we got the 21st was the date,
that
because there's a holiday and then there's, so Mike's gonna work on that. I've been working a lot with Mike in the past week. He's gonna take the lead on planning that. So I'm looking forward to that. I think that would be a good event for us and a good collaboration with the rec department.
Great, and it will be in their flyer too, probably, right?
Yeah, they were gonna do the marketing and,
advertising,
yeah.
Sounds good.
That's great.
Any questions? Mr. McSweeney says no.
I just have one, and I know you said this early, Susan, there's so much covering. There is, did you say it's not approved yet, but there's discussion for the booster clinic? Is that what you
Oh,
said?
yes, so we
Yeah.
did get the vaccine.
Okay.
We got 200 doses of the Moderna. Right now, we're working on getting our first responders in for appointments first. So we have one scheduled for Friday and one for next week for first responders. And then I think if we don't fill that up, we'll send it out to the town employees and see how much response we get from that. And then once, after the holidays, whatever we have left over, we can open it up to other people. But, Yeah, so we do have 200 doses right now.
Now, can we get more?
We can get more. The thing with the Pfizer is it doesn't last as long as the Moderna. So it's only 30 days, so I was a little, so I don't know how much Moderna they have. I'm hearing that a lot of health departments are getting Pfizer, and I've been actually getting calls from other health departments saying, hey, you want some Pfizer? Because they're giving a lot of it, and you have to take a lot of it, and it only lasts for 30 days. So I'm a little hesitant about getting vaccine that we can't give out and that's gonna expire. I don't want that to happen.
I have been getting calls from people who asking about the booster. Are you taking names yet?
So we're gonna, probably by, next week, we will be, and we'll get the word out. We'll let all of you know, and let the public know either somehow through BCAT or the daily paper about first come, first serve type of thing. But we haven't set up the clinics yet for that, but we will. I'm thinking after the holiday, because we don't want to make it too close to the holiday either, because some people have side effects and, may not want to get it around that time. So we just got it this week, so we want to get these first ones in,
Thank you.
this week and next week.
Please let me know. Okay. With that, does anybody else have any other questions? If not, a motion to approve the Director of Public Health reports, plural.
Motion to approve the Director of Public Health report.
Motion by Dr. Solisman, second by?
Second.
Second by Mr. McSweeney. All in favor?
Aye.
Aye.
Is there anything else tonight? Mr. McSweeney, anything? I know you're away, and thank you for giving up your time.
Yeah, no, sorry I'm a remote. This is a little clunky, but it's interesting. It's the first time, well, I mean, we did it for, a year during COVID or longer. No, I thought it was a great meeting, and thank you, Mr. Chairman, as always. Appreciate it.
Adjourned.
Mr. McSweeney, second by Andrew Sheen. All in favor?
Aye.
5-0. Good night, everybody, and we don't meet in 2 weeks. And
Happy
I'm
holidays.
sure- Happy holidays.
Yeah, happy holidays.
Be safe. Be safe.
And wash your hands.
Wash your hands.
Good night, everybody.